In this video, we will talk about topical dosage form. Topical dosage forms are any drug preparations that are applied to the skin or mucous membranes. There are three types of topical dosage forms based on their physical form, called solid, semi-solid, and liquid. Let's discuss them one by one. The solid dosage form is powder. Powder is a solid preparation consisting of a mixture of dry active and inactive substances. The size of the molecule is small, so it doesn't irritate the skin. Characteristics: easily applied to the skin, can be used for large surfaces, fit for obese patients in whom excessive sweating may contribute to the disease, preferable for folded skin area, neck, belly, armpit, and groin, can prevent reinfection. Usually used as an absorbent, antiseptic, antipyretic, and antiperspirant. Next, we will discuss about semi-solid preparations. Those are the most often type of preparation found in topical dosage forms. There are 4 examples of semi-solid preparation. The first one is ointment. Ointment is a homogeneous semi-solid preparation which is applied to the skin or mucous membranes. The ointment contains water that is less than 20% dispersed in the oil, so that the consistency of the ointment looks oilier. Apart from being a carrier for active medicinal substances to treat skin disease, ointment can also provide a protective and moisturizing effect on the skin. Characteristics: oily, has a protective effect and moisturize the skin, has occlusive effects, more difficult to be washed off, preferable for dry skin. The second is cream. Cream is a semi-solid dosage form that contains one or more active substances that dissolve in either a water in oil emulsion or an oil in water emulsion. However, the current term cream is more to describe an oil in water emulsion, which is easier to wash with water and is cosmetically and aesthetically more acceptable than ointment. Characteristics: easier to wash with water, cosmetically better than ointment, less greasy in comparison to ointment, easier to apply, covering part of the skin. The third one is gel. Gel is a clear semi-solid dosage form consisting of small or large molecules in a liquid vehicle that is made like a jelly. There are 2 forms of gel, namely hydrophobic gel and hydrophilic gel. As the name implies, hydrophobic gel contains an oil component, while hydrophilic gel contains a water component. Characteristics: non-greasy formulation, good adherence, form a protective layer, washable, excellent spreadability and cooling effect. The fourth one is paste. Paste is a semi-solid preparation containing a powder that does not dissolve in high concentration or more than 50%. Paste is usually less oily, thicker, and a stiffer consistency when compared to ointments because of the large amount of powder in it. The paste can absorb serous secretions and is not suitable if applied to hairy areas. Characteristics: the consistency is stiffer, thicker, and less oily. Can absorb serious fluid secretions. Not suitable for hairy parts. Now, we are going to discuss about liquid preparation for topical use. Let's start by talking about solution. Solution is a liquid dosage form with a water vehicle. It is clear and homogeneous. The next is tincture. Tincture is a liquid preparation with an alcohol vehicle. Because it contains alcohol, this preparation will cause a stinging feeling when applied to abrasive skin or open wounds. The third example of liquid preparation is lotion. Lotion is a mixture of oil and water with a higher percentage of water. When applied to the skin, the lotion spreads easily, is easily absorbed, and feels light on the skin. The occlusive component of the lotion slows down water loss by keeping the skin surface moist. So, the lotion is suitable for skin problems related to dry skin. Characteristics: easy to spread, easy to absorb, feels light on the skin, suitable for disease associated with dry skin, has cooling effect due to the evaporation of solvents, leaving a thin layer of its medicinal components on the skin surface. Lotion are fit for these following conditions: applied on hairy area, for lesions with minor exudation and ulceration, applied on creases of the neck, applied on folds of the groin and armpit, applied on oozing lesions. Next, we will discuss about some topical dosage forms that are suitable and commonly used in specific organs, such as topical preparation for eyes and ears, spray for nasal, throat, and skin, inhalation for airways, and suppository for vagina and rectal. Let's start by discuss about topical preparations for the eyes. The preparations have to be sterile, non-irritative, and are in the form of semi-solid or liquid. They are applied to the conjunctiva, conjunctival sac, or eyelids. In general, there are two types of eye preparations that are commonly used, called ophthalmic drops and eye ointment. Ophthalmic drop is a liquid or oily solution, suspension, or emulsion that is used for administration through the conjunctival sac. The particle size is very small so as not to irritate the cornea. Sterile. Sterile ingredients or preparation. Proper handling, storage, and administration to avoid contamination. Isotonic with tear to avoid eye irritation due to the hypotonic preparations. Vehicle, sterile water or oil. Advantages: high local concentration, lower systemic adverse drug reaction, cause minor effects on vision. Disadvantages: local hypersensitivity, rapidly washed out by natural tears. Advantages of suspension eye drops in comparison to solution: require less volume of drug than eye solution, and prolonged corneal contact time, hence provide sustained action. Next is eye ointment. It's an ointment dosage form specifically applied to the conjunctiva or eyelids. Please note that ophthalmic ointment must be sterile and does not contain large particles. Eye ointment: sterile and clear, free from particles, have a melting point close to body temperature. Direct application into the conjunctiva to avoid contamination. Or do not use fingers. Advantages: active drug substances exposure is longer. Disadvantages: greasy, cause temporary blurring of vision, therefore should be used during sleeping time or overnight, and the dose might be not accurate. We then continue to discuss about topical preparation for the ears. This route involves direct administration of a drug into the ear canal. Optic topical drug administration provides a variety of advantages. The most significant advantage is the ability to achieve a local drug concentration much higher than what could be achieved via systemic administration. It provides rapid delivery, good patient compliance, and the ability to combine different drugs into a single formulation. The major limitation of topical drug delivery is the potential ototoxicity for some drugs, especially if the drug concentration is very high. Another topical dosage form is a spray. Spray is a solution of water or oil in the form of coarse droplets or solid form with a very fine size given topically. The most common forms of spray in the market are nasal spray, throat spray, and skin spray. Inhalation. As the name implies, inhalation is administered through the nasal passage or oral airways to achieve systemic or local effect. The preparation is in the form of powders, gases, aerosols, solutions, suspensions containing one or more active substances. Aerosol is intended for inhalation therapy, as in the treatment of asthma or emphysema. Particles less than 6 microns will go to bronchioles, while particles less than 2 microns will go to alveoli. MDIs, metered dose inhalers, metering valves are employed when the formulation is a potent substance, as in inhalation therapy. The drug particles must be tiny in order to effectively reach the site of action. This preparation also must be sterile. Advantages of the aerosol inhalation: act rapidly, no first-pass metabolism. Disadvantages: easy to overdose, difficult to handle. Topical dosage form for vagina. Topical vaginal dosage forms are usually in the forms of tablets, suppository, gel, cream, or solution and are inserted into the vagina. Advantageous vaginal suppository or ovule. Act rapidly. Disadvantages may cause local irritation. Vaginal dosage form intended for localized effect. This preparation can have both local and systemic effects. The examples of local effects are as antiseptic, antibacterial, antifungal, and contraceptive. Vaginal suppository or ovules dissolve immediately after vaginal application because of their hygroscopic nature. Suppository. Suppositories are solid topical dosage form in which the active substance and excipients are molded according to the anatomical shape of the rectum to produce a local or systemic effect. Suppositories used for local effects are usually used to treat constipation, to treat pain, irritation, itching, and inflammation due to hemorrhoids. The last topical dosage forms we will discuss are transdermal preparation. Transdermal preparations facilitate the active substance of the drug through the skin into the systemic circulation to produce a systemic effect. The advantages of this preparation are it avoids the first pass effect of the liver, comfortable for the patient because it does not require invasive procedures and can have a long-lasting effect. However, only a few medicinal substances can be made transdermal preparation because the substance must have water and fat-soluble properties. In addition, there were some patients who developed contact dermatitis due to this transdermal preparation. These are all pharmaceutical dosage forms that are used topically. Hopefully, after watching this video, you will understand about this topic. See you in the next video.